Oh, it says there's 2 people in here and it's recording.
Who's in there?
Me.
Oh, there you go. Okay, I'm gonna come over.
Application window.
La, la, la.
Okay.
This is not letting me sign in.
Okay. And she hears.
Oh, she's on the phone.
Hey guys, I'm sorry. Can you hear me? I can't hear you. Can you hear me? I can hear you. That's awesome. Sorry, I was just Aubrey and I were on the phone. We couldn't figure out how to get in and where to go and all that stuff. So all good, all good. So I'm not quite sure. I think Pamela's on there too. I'm not quite sure if we're gonna have an audience. Like I have no idea, but that's fine. We're recording, so it's okay.
Okay.
So I'm guessing, and Aubrey should be making her way in, but I'm guessing we are. Okay, this is super interesting. So I'm guessing.
So is it?
I'm guessing like we have to like it's sharply at. I have to stop you like at 10:33.
Okay.
Because I have to run into the other one, and then hopefully you make your way into the next one, and the next one, and the next one. So the next one's going to be, just so you know, the safe drinking water. So then when we are done here, we all run into The safe drinking water.
I'll just put it down.
It's so nice to see you sit together.
Yes.
That's awesome. So where are you right now?
At Cumberland County Health Department.
Ah, awesome.
Trig is the only one that has an office.
Good for you.
The rest of us work from home.
Well, I guess that's kind of like why I think that's going to be the new norm, right? So many more people are going to work from home. There's like some,
cutting cost, less office space.
Exactly. I was just about to say, I think there's like some cost benefits that are being, plus.
So I actually have a friend that got a job out in Oregon. She drove her car, packed with all of her stuff, all the way out to Oregon. Literally worked for one day, and then the whole nation shut down. And so her boss let her park her car at his house, and she came back. And then after like 3 months, she went back to Oregon to get it. And now she's like trying to find a place to live and kind of like couch surfing, because for the rest of the year, like she could just work from wherever.
Yeah.
I told her she's very like gypsy soul. So I was like, you can go on Airbnb and like rent houses for 3 months,
Yeah.
To live all over the world and just make your way back to Oregon. But I think like her position will become full-time, like remote.
Oh, that's interesting.
I know. She makes a ton of money too.
Well, tell us about that. What kind of job is that?
I know. She texted me. She's my age. We graduated together. And she said, want to come and do my work? And I was like, do I get paid?
She's like, yeah, we'll pay you.
She's in finance.
Okay. Yeah, that's a sector that has a lot of money. I was consulting.
Right.
I was consulting for finance. They were, throwing money our way. I was not the only consultant, but as a company, they were throwing lots of money. So apparently they have it, which is great. All right, we have 4 minutes. Do you guys have what you need? Are you ready to go? I'm just going to do like a really quick intro of the program, very quickly what this is. And then I'm basically going to say the first group we're going to hear from. I think I need to say something about, the next group is going to be, please exit this room and log into the next room, I guess.
Okay.
Maybe. I don't know. And then I'm going to hand it over to you so that you get, your maximum time. So I'll be as short and sweet as possible.
Okay.
All right. And I guess, so I'll try and kick off exactly at 10:15. Yeah. So Pam just put it in the. Okay, awesome. Thank you, Pam. You just put it in the chat box that the next one is at 10:35, 10:50, and 11:10. Perfect.
And
we start at what time?
10:10, 10:20, 10:20.
Yeah, and I might, at 10:15, I'm going to kick off and just do my little thing, and that's going to be a minute or two. So you might be able to start even with like a 10:17. So.
It's so weird because like we're using Tarika's computer. So this is why you see us look right to see our faces, because when you put the presentation up, that's like all you see on my computer.
Yeah.
Yay.
So somehow I saw Kelly just entered, but I don't know. Oh, okay. So we do have some people in the room already. Perfect. Oh, we have actually a really lot of. So I don't know if people can. So I don't know if people can hear me, but welcome. Yes, awesome. Sorry, I responded to text.
I'm excited to see what everybody else went through.
Yeah.
They did.
There's some awesome projects there. Awesome work.
And you collaborated with Nicole? Is that, or no? I saw your name, like you're in Nicole's name, like listed, so I didn't know.
Yeah, no, it's just I'm listed as a speaker just because I'm introducing you guys, and that's it.
Oh, okay.
Yeah, and so Nicole and Kirsten and Heather did all their work as a group. All right, it's coming up on 10:14. I think we have a lot of people out there in the group. Welcome everybody to this session. We're very excited. We're going to kick off at 10:15 promptly. So stay tuned. We're just going to give another minute in case there are anyone who is making their way into this room. And I hope that everyone who is in this room will continue and follow us in the next presentation as well. And Pam just put that time schedule up in the chat. So, all right, well, it's 10:15. Welcome everybody to this session. This is the graduation part of the Emerging Leaders in Public Health program. This is a program that we do from the Medical Society in partnership with the NCPHA, and we're very, very proud of this. And I have to be honest, I always come away from working with this group so inspired by everything, all these great ideas and all this power and energy that is out there in public health, which is so important, and today more important than ever, because it's really where the communities come together and work towards what we're trying to do. I'm not going to take too much time, and before I forget, I always forget to introduce myself. My name is Christina Natterdog. I am from the Medical Society, but I don't want to take too much time away from the group, who has an awesome presentation and an awesome project they're going to share their hard work around. And as I think you all can understand, you know, from like for all of us probably in this forum, COVID, the pandemic obviously did hit, you know, all of our projects and everything we did. And I have to say that I'm so proud of all of the groups that you're going to hear from today, because they all managed to pull through and come up with fantastic work, even though that they were hit by the pandemic and everything had to close down. So I'm so proud and so honored to be part of this. Without any further ado, I want to hand it over to our first group that are going to talk about improving maternal and child health through breastfeeding, normalization, and education. And we're going to hear from Tarika Fuller from Cumberland County Health Department, Caitlin Franklin and Tammy McNeil, who are both from the Richmond Department of Health and Human Services. So Caitlin, Tarika, Tammy, it's all up to you. Thank you.
Welcome.
Good morning, everyone. My name is Tarika Fuller.
I am Caitlin Franklin.
And I am Tammy McNeil.
And thank you so much, Tina, for that introduction on this morning. And as she stated, we're going to be talking about our project in regards to improving maternal and child health through breastfeeding and normalization and education. I'm going to provide a little bit of background information of why we did this. The World Health Organization lets us know that breastfeeding is one of the most effective ways to ensure child health and survival. And however, the Center of Disease and Control Prevention lets us know that oftentimes most mothers will start out breastfeeding their infants, but many times will start early, stop earlier than recommended. In the light of, we do know that breastfeeding is very important to the child, but we also want to know, why are moms stopping early? So I want to provide, why are we encouraging breastfeeding? There's a number of benefits to breastfeeding, and we have found out that 50% are protected from rheumatoid arthritis. 28% are protected against breast cancer. 19% are actually protected from developing high cholesterol. It also protects against decreasing hypertension. You see the numbers there. I don't want to read it to you, but also it helps with cardiovascular disease. It also helps to decrease the development of diabetes. And one of the ones I wanted to point out there is that 36% reduced risk of sudden infant death syndrome, which is very important. And also, many moms will be happy to know that 23% a reduction of middle ear infections. So breastfeeding has a lot of benefits for the mom as well as for the infant. Why are moms stopping? Let's talk about that. So one of the reasons why moms stop is because their expectations of breastfeeding and the reality hits, and oftentimes moms stop. Also, we have noticed and have studied that there was a lot of lack of support from work policies, also lack of support from the paternal leave, also lack of support from the family, and also cultural norms. And this causes a lot of moms to stop breastfeeding very early. And so with this, we felt like education was needed. Okay. So statistical data. Why do we do this? We always got to look back at the statistics. So we see here that the U.S. national average showed that 46.9% of mothers exclusively breastfeed for the first 3 months, while at 6 months, the number decreases down to 25.6% for 6 months. And coming back home to North Carolina, we see here that the national average is 42.5% at 6 months and 23.3% at 3 months. So we're doing okay, North Carolina, but we can do better. All right, so as you can see here, we're still in the 2020, welcome to 2020, and moms are still faced with discrimination when it comes to breastfeeding. You can even look at this sign that we located that says no eating, no drinking, no smoking, and no breastfeeding in our shop. Oh, that's terrible. What are the babies to do, right? When they're hungry, they're hungry. But we thank the surgeon, U.S. Surgeon General, for asking for a call of action to change this narrative for breastfeeding. And that he wanted to promote, to make it unacceptable and to promote safe return back to work for breastfeeding moms, allowing them a lot of time for them to express their breast milk, and also allowing moms to choose to breastfeed and to have support and the opportunity to do so.
So like Tarika said, that there is a disparity gap. And so one of the things that we wanted to do as a part of our leadership development program, we were asked to tackle a public health issue. And as you can see by the data presented to you, that breastfeeding, the lack of breastfeeding, the lack of education, and the lack of normalization is indeed a public health issue. Not only does breastfeeding reduce your chances of cancers to the mother, but also it reduces the sudden infant death syndrome, and it reduces ear infections, and it truly is the world's first vaccine. And so we wanted to educate providers on the benefits of breastfeeding. When looking at public health issues and determining that this was the public health issue that we were going to explore, we wanted to see where we could target education to normalize breastfeeding first. And we thought, as public health providers, that we would like to educate providers on the benefits. And also, we wanted to educate business owners on the laws that protect breastfeeding mothers when they return to work, because that was one of the largest or the highest barriers of breastfeeding moms from stopping breastfeeding, because they thought, being a working mom and a breastfeeding mom, that they couldn't balance both, and that their employer didn't necessarily enhance their breastfeeding journey. And so therefore they ultimately decided to quit. The primary aims of our public health issue that we chose for our leadership development program was to improve breastfeeding normalization. So we educated providers that were within our communities, and we identified large employers in our rural counties to educate them on the laws of providing safe and adequate spaces for breastfeeding mothers to utilize, with the idea that if a breastfeeding mother had the space, that they could take the time during their workday to express breast milk to continue their breastfeeding journey, and to reduce that barrier of continuing their breastfeeding journey. And we also initiated and supported a community breastfeeding coalition support group. Our goal was to reach 7 counties in Eastern North Carolina. We worked predominantly in Cumberland, Hoke, Montgomery, Richmond, and Scotland. Harnett and Moore counties were supportive counties, as The Montgomery and Richmond County do not have birthing centers. Therefore, Harnett and Moore bridge the gap of coverage for our breastfeeding mothers, anyone receiving maternal care.
So when we look at our project methods, looking back to our Surgeon General's guidelines, mothers were not continuing to breastfeed, not for lack of support from their family members, but lack of support in their employers. So we took the charge and educated employers. We met with the HR for Richmond, Montgomery, Hoke, and Cumberland County school systems. And we were able to put in nursing spaces in Richmond, Montgomery, and Hope County schools, with Cumberland to put in their spaces this year. We had the COVID come in as we were putting the spaces in there. So we were able to also put in spaces in two large employers that are factory employers in Montgomery County, and then Purdue Farm. So we did a total of 37 total spaces. We also gave 2 during Black Breastfeeding Week that we put in spaces for Black-owned businesses to show support within the communities and to bridge the gap. So we looked at also supplying support for childcare facilities, making sure that we were including everyone in the education pieces. So we did education with the childcare facilities as well. You also have a picture of, these are one of the spaces that we did in an elementary school in Hope County. This particular one as well was, the principals were very supportive and also went through the training with us. And this was actually a male principal in an elementary school in Hope County. So they were gracious enough to give us some pictures, and it's a beautiful space. The law also states that there has to be signage. Well, remembering that those spaces can function as another space, it doesn't have to be a space at all times. Signage was expensive, so we purchased door hangers and just made bags for the moms, and they could put it out as they needed it. So what you're seeing here is the information that was given to the moms when they returned back to school. They also, we had little totes made up with their school emblem on there that they could store their milk in. We were able to educate the moms, the nursing staff. We also were included in our breastfeeding community outreach coalition meetings and outreach events as well.
So overall, we definitely helped our champions, our stakeholders within our community bridge the gap and reduce barriers to breastfeeding mothers. Our breastfeeding coalition are made up of the health department, the local hospitals, breastfeeding and doula services that are also offered throughout the counties, as well as breastfeeding mothers and other providers. Our breastfeeding coalition meetings were designed to discuss any barriers or hindrances to our community and the breastfeeding mothers that are in our community, and ways that we could overcome that and reduce those barriers. We also spent the time organizing outreach events and ways that we could get out and be at the forefront for our mothers. We did a lot of education at our outreach events, and they were a major part to the educating piece pre-COVID-19. We believe that we helped reduce the lack of normalization of breastfeeding. It is indeed a global initiative, and it requires a global effort. So we tried to do our part in these 7 counties. The methods utilized in this project help change the narrative for breastfeeding. You know, breastfeeding is 110% a hard thing to do, and we understand and we sympathize with all of our moms, but we provided sustainable results and means so that moms could continue their breastfeeding journey. Not only did we provide breastfeeding spaces in some of the largest employers in some of these counties, we provided teachers means to breastfeed while still teaching and having that moment during their day to express breast milk. We also put breastfeeding spaces in local businesses, one of which was a restaurant which had 11 pregnant, postpartum or breastfeeding mothers in their restaurant. And although we couldn't designate a space specifically for those breastfeeding moms, we did a collaboration in a manager's office. So the signage that you saw in one of our pictures, the moms were able to use and put on the door to say that the room was in use. In some of these rooms, we provided simple things like a sound machine, or we provided some nursing covers, bobby pillows. We even provided little lunch bags that were specifically designed to hold express breast milk bottles if there was not space for a mini fridge. But things like a mini fridge or a chair or a lamp were also provided in some space. And every space was very unique to the organization and the needs of the breastfeeding mothers. So that is it. That is what we did. We had the time of our life, and we met some really great people. And we hope that we made just the smallest dent in normalizing breastfeeding. And thank you, everyone that came to listen to our presentation.
Thank you.
Thank you.
Thank you so much. I think we will pretend that we hear clapping in the other room. So we have 2 minutes for any questions. So if anyone has a question to the group, please put them in the chat box. And while we wait for that, I have a question for you. So what is going to be the continuation of this project?
So ideally, we will continue to educate more of the providers and the organizations that are in all of these counties. Pre-COVID, we had all intention of putting in more breastfeeding spaces, but because a lot of organizations and small businesses aren't open, or you can only have minimal amount of people, it hasn't been the most ideal environment to come in and introduce what to them may be an added cost. And one thing I would like to add is that, you know, ideally you would assume that these small businesses or these larger employers would provide this space for their employees on their own expense. But due to the hinder of time and the need, we had grant funding to provide these spaces so that it was not an argument of who was going to pay for what. So we hope in the near future, when our state opens up a little bit more and people are resuming shopping and more people are returning back to work, that we will then be able to implement more breastfeeding spaces. But we are doing our efforts on educating through social media platforms, and we just recently have been able to go to some drive-through outreach events. So we are still educating. It's just not on the largest scale.
Right. Well, I think it's a fantastic project, and I hope you see the compliments you're receiving in the chat box from your fellow students as well as other people in the audience. For everybody in the audience, I also want you to know that we have the group's project write-up. So if you want to have more details about how they went about this and even get in touch with this group, anyone in this group, to hear how you can do this in your county, we will make that available for you, and we're trying to figure out how to attach how to put an attachment in the chat right now. But if not, we will make sure that we get that to Kim and Pam as well, so that they can share with everybody at the conference. Thank you so much. We are now going to head on to the next group, which is going to be on safe water. So please log out this room and log into the next room, and we'll see you there. And again, thank you so much for all your hard work.
Thank you.
Together. Thank you.